My name is Ashleigh Rodgers, and my paper was on proton therapy and its use in non-small cell lung cancer. Lung cancer is a leading cause of cancer-related deaths in the world. Every year, lung cancer kills more people than colon, breast, prostate, and ovarian cancer do combined. There are two types of lung cancer, small cell lung cancer and non-small cell lung cancer. In the United States, over 85% of lung cancers diagnosed are the non-small cell lung cancer. Using radiation to stop the growth of lung cancer is termed radiation therapy. Radiation therapy is used for treatment in about 75% of patients with lung cancer. However, a newer form of treatment is becoming available, and it's known as the proton therapy. Lung cancer. Lung cancer is a cancer that begins in the lungs. As discussed, there are two major types of lung cancer that are named based on the appearance of the lung cancer cells under a microscope. Small cell lung cancer, also called SCLC, is typically seen in heavy smokers and is the less common of the types. Non-small cell lung cancer, or NSCLC, includes several forms of cancer that behave similarly, including squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Lung cancer has several risk factors, smoking being the most common risk factor. The length of time a person has been smoking and the number of cigarettes a person has smoked increases their chance of developing lung cancer. Doctors believe smoking damages the cells that line the lungs, and initial damage from smoking may be able to be repaired by the body. However, with increased smoking and adding that smoking can add more damage to the lung cells, and the body may not be able to repair that after, and can lead to that increased chance of developing lung cancer. People who have never smoked but been around someone who's smoked often and for an extended time is often called secondhand smoke, can also develop lung cancer. Other risk factors include previous radiation therapy treatment, exposure to radon gas, and a family history to lung cancer. Early detection of lung cancer can be difficult, as lung cancer will very rarely show signs or symptoms until the disease is advanced. Signs and symptoms of lung cancer, however, include a new cough that won't go away, coughing up blood, shortness of breath, chest pain, losing weight without trying, bone pain, and headaches. Treatment of lung cancer can be a challenge due to the different types and the different stages of lung cancer. Lung cancer in early stages is typically treated with surgery or radiation therapy, while advanced lung cancers are typically treated with combinations of surgery, radiation therapy, and chemotherapy. Advanced non-small cell lung cancer can be a challenge to treat because it's not generally operable, and therefore needs to be treated with combinations of chemotherapy and radiation therapy. Here in this picture, you can see there's a squamous cell carcinoma in the lower right lobe of the right lung, which is an example of the non-small cell lung cancer. Radiation therapy is a traditional form of treatment for cancers, including non-small cell lung cancer, and is a form of ionizing treatment using photons that delivers dose throughout the course of its beam path. Ionizing photons can damage even the healthy cells, causing abnormal cellular function and potentially cellular death. Radiation therapy for early stages of lung cancer is usually reserved for patients who are inoperable or who decline surgery. Radiation therapy using two-dimensional radiographs first arose as an option for curative treatment in the 1950s, and the current standard for treating non-small cell lung cancer in the United States is three-dimensional conformal radiotherapy, and it's been that way since it's gained its worldwide popularity back in the 1990s. However, radiation therapy is a broad term and can be broken down into two different types. One type of radiation therapy is known as stereotactic body radiation therapy, and that is done by delivering larger doses per fraction or per session of treatment, and it's been a successful form of treatment by reducing toxicity and improving the clinical outcomes in patients. The second type is known as intensity modulated radiation therapy and is another form of radiation therapy. In this form, intensity levels vary across the radiation beams, which allow for a better and more even dose distribution over target areas and decreases toxicity to the surrounding healthy tissues. However, despite these advancements in the field and the advantages they have produced, one disadvantage of radiation therapy is it still uses radiation, which is harmful and can damage healthy cells. And even after radiation therapy, tumor reoccurrence is common, and those low doses of radiation can harm those healthy tissues. And the heart, esophagus, and spinal cord are also healthy structures that surround the lungs when you're trying to treat a non-small cell lung cancer. In fact, the amount of radiotherapy typically needed for a cure is over the tolerance of those surrounding healthy structures. Proton therapy, however, is a relatively new form of radiation therapy, is an excellent choice when it comes to treating non-small cell lung cancer. Proton therapy is when high energy from charged protons are used for treatment. Proton therapy was initially described in 1946 by physicist Robert Wilson, and to date is the most technically advanced method to deliver radiation to cancerous tumors for treatment. And the first proton therapy center was established in Loma Linda, California in 1990, and since that development, 70 more proton centers have emerged worldwide, and over 170,000 patients have been treated using proton therapy. Proton therapy for the treatment of cancer was approved by the FDA in 1988, and then their treatment ranges from about 15 to 45 minutes a day for 5 days a week to 4 to 8 weeks, depending on the type of cancer that they're trying to treat. Proton therapy can be used alone or in combination with other treatment modalities such as death surgery and chemotherapies. And it's been used in a variety of cases from early disease, advanced disease, irradiation, in the post-operative setting. And although it's a new form for non-small cell lung cancer, it's also been used to treat brain tumors, breast cancer, cancer in children, and many other forms of cancer. Here's just a picture that kind of shows those proton centers in the United States, or ones that are currently under construction in the United States. So there's a few differences between protons and photons. Protons are a subatomic particle that have a mass and a positive charge, while photons are electromagnetic energy that have no mass and no charge. One advantage of the proton therapy is that the protons are more biologically effective at killing tumors than photons. And when delivering the dose with photon therapy, the dose will enter the body, pass through the tissues, and then exit the body, irradiating all those surrounding structures. Compared with proton therapy, the charged protons will deposit its dose at a specific depth and location in effort to spare the healthy surrounding tissues. Here's just a kind of the difference between the photon and the proton, just kind of broken down to what we just discussed. The Bragg peak is a unique characteristic which helps it make a useful treatment. The Bragg peak is a natural occurrence in how protons move and release their energy. With photon therapy, as discussed, the dose is deposited continually and has an exit dose. However, in proton therapy, the energy is deposited at a certain depth at Bragg peak, and the Bragg peak can be changed and placed at any depth determined by the location of the tumor. Releasing all that energy at the site of the Bragg peak will result in little to no exit dose or damage to the healthy tissue beyond that tumor site. In this picture on the left, you can see that's treated with photon therapy. So you can see the dose comes into the body, treats that tumor, and then continues throughout the body. As with on the right, you can see with proton therapy, it will enter the body, treat that tumor, and very little get past that tumor throughout into the rest of the body. There are a couple different types of proton therapy. The way the proton therapy is planned and the technique used to deliver it will determine what type is being used. The two types are passively scattered proton therapy and active scanning proton therapy. In both ways, take a single high energy monoenergetic proton beam and disperse protons to deliver a dose to targets, in which the targets are typically large and irregularly shaped. First type is passively scattered proton therapy, and is typically called passive scattering PS, and has been used for decades. This form of delivery is effective for tumors that are typically simple in shape, position, and proximity to organs at risk. Passive scattering uses a physical scatterer, typically two scatterers, and materials placed in the beam's pathways to scatter the protons to a desired field. Passive scattering uses a device called a compensator to help deliver the protons. Compensators are custom made for each patient and are used to help shape the proton beams to just the distal edge of the target tumor. Apertures are thus also then used in combinations with the compensators. Apertures are also custom made for each patient, and they contain a hole approximately the shape of the target tumor for the proton beam to pass through to help limit the beam margin to help spare those normal, healthy surrounding tissues. Passive scattering allows for higher confidence in where the dose will be delivered, but it still has its disadvantages. Passive scattering is unable to conform to the proximal edge of the target, and it also is limited in its ability to match the shape of the target perfectly. which could potentially lead to a dose to the healthy surrounding tissues of the proximal target. Therefore, passive scattering is suited for lung tumors with simple anatomy that do not have involvement with the other lung, the hilum, or the mediastinal nodes. Here, this picture just kind of better shows in a visual format that passive scattering. So it'll hit the two scatterers, those compostures, and the apertures before it goes into the body to treat that tumor. The second form of proton therapy is active scanning proton therapy, which is also called pencil beam scanning proton therapy. It's a newer technique and allows for larger target coverage. And pencil beam scanning uses magnets at the exit of the beam to help deflect and deliver the dose across an entire target. It also uses a technique called spot scanning which is used to help shift the beam throughout the target, leaving spots of protons throughout it. Is kind of done similarly to passive scattering, however, uses a series of wedges, and the wedges are known collectively as ESS, and they help degrade the energy in a stepwise fashion, allowing for a layer by layer approach to distribute the protons. In this way, each layer will have independent spots for dose delivery, allowing for coverage of both the distal and the proximal edge of the target. And active scanning makes intensity modulated proton therapy possible. Intensity modulated proton therapy allows for the intensity of the beam to be enhanced and to create a dose distribution highly similar to the target shape, allowing for high dose to be delivered to the target area and none to be delivered to the healthy surrounding structures. Active scanning also omits the use of compensators and apertures, which only add time, labor, and cost to passive scanning, since they are custom made to each individual. And active scanning still has its limitations, although it's overall more sensitive to motion, making active scanning better suited for treatments with limited motion or more detailed locations requiring a better sparing of healthy surrounding structures, such as advanced tumors or in the post-operative setting. This picture just kind of shows active scanning being used. I couldn't find a picture with the actual word wedges on there, but the range shifter plate is just another word for wedges. So that's wedges, and those are the same things. And you can see how the wedges help make it a stepwise fashion, so the whole tumor is getting dose. Advantages of proton therapy include the survival rate, the decreased dose, quality of life, and fewer side effects. Overall survival rate in proton therapy is over 5 years is higher, with 22% compared to 16% with photon therapy treatment. And then one study even compared proton therapy to intensity modulated radiotherapy, which is that more advanced photon therapy option, and found that proton therapy can deliver similar or higher dose to the target area, but with roughly 65% reduction in total body dose received. As discussed, that one disadvantage to radiation therapy is that the healthy structures surrounding the target area are also receiving radiation dose. Proton therapy decreases and in some cases eliminates that dose to those healthy structures. And one of the greatest advantages that it has is the ability to spare dose to the heart. Proton therapy provides patients receiving this therapy to maintain a very high quality of life during and after treatments due to its non-invasive and painless treatments. For adding this form of treatment makes these patients who are going through a difficult time keep their normal style of life and prevent them from completely changing their life around in order to cope with the treatment. And it also provides significant benefits in the pediatric cancer due to a high curability rate, longer remaining lifespan, and decreased long-term side effects, which will therefore improve their quality of life. Proton therapy can also prevent late deliberating side effects such as hemorrhage, fistulas, and paralysis, which is a major advantage. Due to proton therapy resulting in fewer side effects, patients could potentially have a better survival rate and then improved quality of life, tying it into the other two side effects. And overall, the benefit of proton therapy in the end can reduce morbidity and largely impact overall survival rate. This is just a chart that kind of just takes each advantage we just talked about and just why it's a advantage and how it makes an advantage of proton therapy. Disadvantage of proton therapies, although despite their But despite all their advantages, they do have disadvantages. Just like any form of medical treatment, proton therapy has certain side effects contributed to it, including fatigue, digestion problems, headaches, hair loss, skin redness, and soreness all around the treatment area. However, proton therapy does result in fewer, less severe, short and long-term side effects compared to traditional radiation therapy due to its ability to help deliver less radiation to those healthy tissues. And although the major disadvantages of proton therapy for non-small cell lung cancer, though, are tumor, motion, and cost. When treating non-small cell lung cancer, the tumor is constantly moving due to the patient breathing, making the tumor hard to treat. And proton therapy is extremely sensitive to atomic changes such as motion and density changes, and the motion during dose delivery could potentially lead to underdosing the main target area. Despite these challenges, accounting for tumor motion can be worked into the treatment plan using techniques such as motion migration techniques, 4D CT stimulation, or also called 4D image guidance, and adaptive replanning. Adaptive replanning is the ability to help replan the treatment to adapt to changing circumstances, and especially important in proton therapy due to its sensitivities to atomic changes. Cost is another significant disadvantage for proton therapy. Proton therapy compared to photon therapy is typically associated with higher cost and currently is not universally approved by insurance carriers. Proton therapy is estimated to be 1.6 to 2.4 times more expensive than photon therapy. However, it could be argued that proton therapy is actually overall cheaper. As discussed earlier, some of the proton therapy advantages include the effectiveness of treating an initial tumor and decreasing reoccurrences, reducing the overall cost because if the tumor does not reoccur, the individual will not need to repay for additional treatment costs. Compared to photon therapy, where tumor reoccurrence is more likely and therefore would need to pay for additional treatment. So although a disadvantage of proton therapy costs could also be looked at justifiably. Future of proton therapy since proton therapy is still relatively a new modality of treatment, in general, new advancements are still being made in proton therapy, including the planning, delivery, and evaluation. For non-small cell lung cancer, the use of a breathing cycle and dual energy CT or DEC is being investigated. The breathing cycle for moving tumors such as non-small cell lung cancer can potentially help more accurately show where the dose is going in the body against the movement of the chest. Using the DEC can also help reduce range uncertainties during delivery of the treatment. Range uncertainty can be improved by 50% using DEC, and the improvement of DEC to accurately sculpt the proton radiation to the non-small cell lung cancer can lead to higher tissue sparing and treat tumors next to critical structures with potentially higher dose and a better confidence. Enhancing software of the computers can also potentially help in the future of proton therapy. For commercial treatment planning software, Monte Carlo and fast Monte Carlo techniques are being developed. The techniques will have the ability to detect where the proton particles are traveling and depositing their energy with better accuracy, allowing for more confidence in that visual treatment plan created by physicians and dosimetrists. Just naturally, as more people begin to understand the characteristics of protons in the treatment, modeling the ability to better understand and judge treatment plans for safety and efficiency will also improve. In conclusion, proton therapy is an excellent new form of radiation therapy. And although proton therapy was discovered in the 1940s, its use as a form of cancer treatment is still relatively new. But as advancements in the field are made and as time continues, the understanding and use of proton therapy will also increase, making it a positive and exciting new treatment option for non-small cell lung cancer. Thank you.